guys, thank you for joining us today. I'm going to be doing a full anterior leg massage with focus on the quads. So I'm going to go ahead and get started. And I'm actually going to get started without oil, and I'm going to go right in with some lighter compression. So I'm going to use both of my hands, and I'm going to start up by the anterior hip flexors, and I'm going to start just working my way down with a lighter touch. And I'm going to work my way up the center of the quads. And I might do this, 3 times each time, just spending a little bit longer and going a little bit deeper, especially on the parts that feel more contracted. So when I'm going in with these compressions, I just gradually increase my pressure. I don't just go right in. Let the muscles get used to more pressure. And trying to do these compressions with, oil already on the leg would be harder. So this time I'm gonna, widen my stance a little bit and start going a little bit deeper than before. And working my way up the middle. You always want to be working with as straight of an arm as possible. You don't want an exaggerated bend in your elbows because you're going to put a lot of pressure on your own shoulders. Just making sure that you feel comfortable as you work. I'm going to go ahead and grab my oil. And just starting from the inside and working my way out. Even as I'm applying this oil, I'm working as a whole unit. I'm not just working with my hands. They're really an extension of my core and whole body. And finally, I'm going to go ahead and work my way in with both hands in a soft fist position, and I'm just going to start working my way up with a medium pressure. And working my way out towards the hip. And if the hand is in the way, you can always just put your client's hand on their stomach. And always just, when in doubt, if you're feeling discomfort in your own back, just widen your stance. So always, just when you're doing, any type of massage, it's really important to work organically and stay tuned into what's going on with each body. We're all different. And I'm going to go ahead and start working my way in with just one hand. Working a little bit more in a little bit more detail. instead of just, doing a broader glide, I'm kind of breaking that up into little micro movements. And I just find that it's a little bit more difficult to find a comfortable position as the therapist when working on the anterior leg. And just a wider stance is kind of what's helped me the most. So I'm going to go ahead and go in with a kneading technique that's really straightforward and pretty simple. So I'm just going to start to rotate my hand. And this is so healthy for these different quadricep muscles. You can do a little bit of cross fiber work. If you're starting to feel like you're not as stable, you can always hold onto your wrist when you get to the outer part of that leg. And just working my way up. I find that this is more effective than trying to do petrissage here. I feel like you are a lot more in one place. I think, petrissage just requires a lot more energy, and I'm not sure that it's more efficient. But it feels really good. It's a great technique to include as well. And I'm going to go in with both hands. The quadricep muscles are pretty big, so I'm usually hesitant to do very much thumb work when working on them. And I'm going to go in with my forearm. So to work this top part of the leg, I'm just going to go in with my right forearm. And I want to actually work on the IT band a little bit. So I'm going to make sure that there's some oil on the outer part of that leg. And I'm going to start going in with my opposite forearm and nice wide stance here. Just working my way up. If your client is enjoying the deeper work but is feeling like it's a little too much, you can use a distraction technique. You can gently rock your forearm. Feels really nice, especially as you get closer to the IT band. And finally, I'm going to just go in, starting to work my way into the IT band just slightly. I'm not going to do anything super deep. And it can feel really nice to just offer a little bit of lengthening to these different muscles, so you can just stabilize the muscle with one forearm and then massage with the other. And I like to end how I started, just to kind of tie it all up. And I'm actually going to go ahead and just move to the opposite quad. So I'm going to start with these oilless compressions. And when you make these transitions, it's an opportunity to kind of take a breath and check in with your own body. Going back in, so I'm just going to I'm going to start up here, work my way down. And Taya had said that she was at the gym and kind of felt some pain in these quadricep muscles. So just kind of going in with a little bit of caution. And working my way up. So this is an opportunity for the muscles the soft tissue to kind of adjust to the work, and for me to get more familiar with what's happening on this side. So going just a little bit deeper this time. This kind of gives me a sense of where I need to be spending most of my time during this session. And just one more time down the leg, and I'm going to really start to go in with a little bit more pressure, just gradually increasing my pressure as I hold. This is really healthy for the muscles if you start lighter and work your way in. It's not something that you can visually see that well, but you can certainly feel it when you're doing it. And if you feel the muscle kind of start to fight you, you're probably going a little too hard. And I'm going to grab my oil. And just starting from the inside, working my way out. If you try to press firmly on the way down, it's just going to feel like a choppy movement. So just nice light glide down. And I'm going to go in with my hands. For some reason, I find that it's most difficult to to practice proper body mechanics doing the anterior leg work. So just as much as possible, take care of your own posture as you're working. And just try and keep your arms as straight as you can. You might need to step away from the table a little bit. You know, your arms don't need to be like rigidly straight, but not super bent either. I'm going to start going in with just one hand, being a little more detailed in my work. So instead of like that long, broad stroke, I'm starting to do shorter movements with my hand. Just breaking up some of those fascial restrictions. And if your client has a sensitive spot, maybe like go back and forth between different different quadricep muscles instead of just lingering on one too long. You can also kind of broaden the area that you're working with if there's a lot of sensitivity. And generally when I'm doing this kneading technique, you want to use your hand that's closest to the table. So instead of reaching over, it would be a lot harder. So I'm just going to start to... It can feel kind of funny at first when you're using your non-dominant hand. And it can actually really help to like guide your hand with your dominant hand. This is a really healthy thing to do for the muscles. And again, this isn't necessary. I just really like how it feels and I feel more stable. And I just want to thank a few of our patrons. I'd like to thank Brandy Demet, Hannah Canty, and Heather Carter. Thank you so much for your support. We really appreciate you guys. And just wrapping things up here, a nice broad... Actually, I need to do that forearm work, so I'm going to go ahead and transition right into my left forearm to start. And I have noticed throughout this session that Taya's quad on this side is fairly sensitive, so using a little bit less pressure than the other side. And going in, facing the table here, and just starting to work my way with that opposite forearm, using my whole body, working as one unit as much as I can. And I'm just gonna make sure there's plenty of oil. And working my way into the IT band, just slightly. And just ending how I started, tying it all together. And that is it for today.